just as a reminder, and here, let me turn on the light so it's a bit easier to see. Right. As far as this bucky goes, okay, cassette slides into here, clamp it into place. Oops. Okay, so clamp it nice and tight, doesn't move, then you put it inside. So for us, when we're doing humerus, the cassette is going to be like this because humerus is a long bone. We need that 14 by 17. When we get to AC joints, we will need to turn this crosswise. So, in that case, crosswise, how tall is the cassette this way?
That's a good question.
Well, what size is the cassette?
14 by 17.
So which one's the 14 and which one's the 17?
The shorter one is 14.
Yes, so how tall is it this way?
14.
14, great. So I'm going to take this and I'm going to move it over to where it clicks onto the 14 right there. Top, same thing. I'm going to move this, click it onto the 14 right there. And now when I slide this in, you see how it perfectly fits? Right, take this, and again, clamp it together, and it goes inside. Right. Most of our positions will actually be done on the 10 by 12 because this anatomy is rather small. So, if the 10 by 12 is lengthwise, how tall is it?
12.
12. Great. So over here, I'm going to take this, pop it over to the 12, right there. Up top, I'm going to take this, pop it to the 12, fits right inside here, clamp it shut, and in it goes. If I was going to do this crosswise, how tall is it now?
Yeah, 10, right?
10, very good. So take this, pop it to the 10, pop this to the 10, okay, fits perfectly inside, clamp it, nice and tight, and it goes inside. Okay.
Are those lines supposed to be lining up like here?
Yes, so these white lines on the cassette will line up to the red lines here on the bucky. They're not going to line up here in the middle, but they're going to line up to the red instead. So you're doing this, right, and you put it in like this and you clamp, and you notice it's not quite there, that's because it's not actually clamped in. Alright, so are we okay with the bucky here?
Yes.
Alright, great. We'll go ahead and start with the humerus.
The humerus is only the actually I forgot what my question was.
Humerus is the only one that requires a 14 by 17 lengthwise. Okay, and now for our tube. Because last time we used the tube, we were completely tabletop, right? This time we do need to make sure to lock to our bucky. So remember, in this room, right, unlike LBJ, we need to tell the machine when we want to turn the locks on and off. And we do that, that's right, with detent. So I'm going to turn detent on. Okay, it's now green, which means when I move this way, I'm going to hear a click. Heard that click? Right, I was going a bit fast, so I moved beyond where I was supposed to. So let me just slowly move back. And there we go. It's now in place. Okay. I'm going to take my longitudinal, do the same thing. I'm going to slide forwards until I click onto the 40. Interesting. It didn't click, did it?
No.
Why not?
Detent on.
Because where am I telling them?
Oh, you telling the machine you want tabletop. That's why it didn't
right.
stop.
I need to make sure to turn this to wall first. Once I turn this to wall, when I pass by that, it clicks in place. Right. So the machine does know how to stop in place. If it's not stopping, chances are either the detent is not on or the receptor setting is incorrect. Take our tube, 40 SID, 90 degrees, so it's aimed here at our IR. Okay, let's see, so who would like to be our first patient? So one person's going to be our patient, one person's going to be dual wielding the phones.
You can get here, Reagan.
I was gonna say, I think I was dead.
So, as always, dressing instructions are to just remove anything in the area of interest. Okay. We are still going to shield our patient. So, got the shield here. If you just hold this in the front, I'm going to go around the back and help you up with this.
Okay.
All right. And then back against the board, please. We're going to be doing this AP. All right. Let's see. So I'm going to turn the light back down now. So humerus actually isn't too bad. The idea is that we are going to center mid-humerus. What is mid-humerus?
Middle of the humerus.
That's right, middle of the humerus. Okay, so if we take a look here. Okay. Right now, I'm more MSP to my patient, right? I want to focus on one of the humeri. For lab, I'm going to say that I want to, or at least for this demonstration, I'm going to say I want to do the left humerus. So in that case, Reagan, could you step a bit to your right? All right, great. Too far? So, see how we've got our central ray now, right? Aiming at the humerus. Now, for the humerus, it does start up here at the humeral head, right? It ends down here at the elbow joint. So we do want to make sure we're halfway. But before that, there are two things we need to do. Number one, we're going to slightly abduct the arm because we don't want the arm right next to the body. We want to put just a tiny bit of space between the arm and the body. So great, as you can see, Reagan moved her arm slightly away. So there's going to be a very slight angle, but you don't want to take the arm and just do this to it. Right? You don't want this huge angle away from the body, just very slight like we had before. The second thing we need to do is we need to rotate the arm into a true AP. And we do this by putting the elbow into a true AP. And how did we tell when we have a true AP of the elbow?
Is that one? Actually, I don't
The epicondyles will be parallel.
Good. The epicondyles are parallel to the IR. Right? They're the same distance from the IR. So we're going to supinate the hand. We're going to turn the hand forwards until that elbow, those epicondyles are parallel to the IR. In this case, the hand is facing forwards, correct? Mm-hmm. But this elbow is actually over-rotated. Right now it's almost like an external oblique.
Mm-hmm.
So we're just going to turn that in just a little bit. Mm-hmm. Very good. And that is our AP. So even though the hand's not perfectly forwards, right? That's okay because it is the elbow here that we're focusing on. It's the humerus that we're trying to get AP, right? Not the hand. So now that we've done that, we can now focus on getting our centering. So right now, I actually think we're looking pretty good. Humeral head, elbow, pretty close to midway. We can maybe drop this down just a tiny bit. Nope, we went too far, I think. We'll go back up there. All right. Line this up. It's already lined up, very convenient. And now, if I wanted to collimate, right, you notice an issue here. A lot of light over here, right?
Yes.
Can I collimate this light away? Can I keep going in like this? No.
No, it's gonna cut the elbow.
That's right, I'm gonna cut down here, right? So, how do I collimate on a humerus? Depending on where you work, they may or may not let you turn the tube head. If they do not let you turn the tube head, this is the furthest you can go. But if they do allow you to turn the tube head, you're going to take this and angle it so that it matches the shape of the humerus, or the direction of the humerus. And now we can come all the way in to the border of the humerus. Do you see that? So ideally you would be able to angle following the long axis of this humerus so that you can catch it. Right? Just leave maybe about an inch of light on either side of the humerus. Make sure you give yourself about like 2 inches of light past the joint spaces. That way you're certain you have the joints. And then we can put our markers. So in this case, which arm is it?
Left.
Left arm. So I'm going to take my marker and mark it as my left. Okay. And that is my AP humerus. As far as breathing instructions go, it's just taking a deep breath. Actually, nope, sorry, can't say that. Just breathe normally. Sorry. So as far as breathing instructions go, it is just suspend respiration. So just hold your breath. X-ray, you can breathe.
So is that to reduce movement?
Correct.
Okay.
Just to reduce motion.
Okay. And then it doesn't matter whether or not, because I guess you could technically push your arm all the way back against it.
Great question. So do we want to reduce OID? Yes. But at the same time, we don't want to angle the arm.
Right.
So, for example, if you just put your back flat against the board, right? Notice that there is this space between the shoulder and the IR. So if I take the elbow and push it all the way flat, it actually angles backwards, right? Which we do not want. So in this case, it's okay to have the arm just straight here. Now, what Reagan did earlier was actually really nice. We had the patient rotate just slightly toward us, so a very slight oblique, but putting the shoulder flat against the IR. By doing this, now we can put the entire arm flat against the IR to minimize OID, right? And as long as we make sure that our elbow here is still AP, upper condyles are still same distance from the IR, right? Nice and parallel. This is still an AP humerus. Okay, so if you're able to, just turn your patient very slightly, get that shoulder nice and close, and you can put the entire arm flush against the IR. So no OID. Okay, great question. So, are we okay with the AP humerus?
Yeah.
All right, in this case, let's do the lateral humerus. Lateral humerus is going to be the same idea, but this time instead of palm forwards, we're going to turn it so we're doing almost like those chicken wings again. Right? Good. So internally rotate. Good. Slight bend of the elbow. And as you can see, we're putting these epicondyles perpendicular to the IR this time. Okay. Once again, I am not going to take the patient's arm and bend it a whole bunch like this. Right? I'm just going to have it slightly bent this way. Okay. So my centering should be about the same. I'm still following the long axis of my humerus. Marker is still the same. And so this would be my lateral humerus. Right? Just check those epicondyles. Make sure they are perpendicular. Is there some OID? Yes. That's okay as long as I make sure that the arm is still straight. Can I reduce this OID? Potentially. Right? Once again, we can try and rotate our patient towards the board, but that would require them to be able to twist their arm even further, which may not be possible. So remember, prioritize your positioning over your OID. If you have to make a choice between a perfect lateral and a slightly not perfect lateral with less OID, always stick with your perfect lateral. It's okay to have some OID. Okay, now, I am going to warn you, when you go to clinic, you will not see techs do lateral humerus like this. Okay, I'm just going to warn you ahead of time. When you go to clinic, this is how techs will do a lateral humerus. Okay, back against the board, hand over your stomach. Lateral humerus. Is this a lateral humerus?
No.
Why not?
The epicondyles, it's like they're not perpendicular.
Correct. These epicondyles are not perpendicular, so this is not a true lateral humerus. If you do want to do it this way with the hand over the stomach, you need to take this arm and rotate it forwards. And now you have a ton of OID, right?
Right.
So ideally, if the patient is able to, it's better to just rotate the arm like this than try and put it over the stomach. I mean, you already asked the patients to do this when you do chest x-rays, right? Sometimes you ask them to hold a bar, right? But if you do chicken wings, right? Patients can already do this for chests. They can do the same thing for the humerus. Okay, any questions so far? Still okay? Okay, so the final humerus exam we're going to discuss is the trauma lateral humerus. This is your Lawrence method transthoracic humerus. So the idea here is, let's say that the arm is broken. Okay, so let's pretend your arm is broken. Okay, so it's just hanging down by your side, right? Can I turn this?
No.
Does it hurt?
Yes.
Okay, so I can shoot a picture like this, which is kind of AP, right? But I can't turn this arm for a lateral. Does that make sense?
Right.
So how do I get a lateral view of this arm if I'm not allowed to move it? The idea is that we turn the entire patient lateral. So turn all the way towards me. All the way towards me. Come forwards. Come forwards. And now, if you lift this right arm up, we're going to shoot through the chest, like a lateral chest x-ray, and we're going to look at the arm through the chest. So we're going to take a look at this lateral by shooting through the thorax. So transthoracic. Does that make sense?
Yes, so would the arm still have to be turned?
It will not. You just leave it hanging straight down.
Well, so how is that lateral?
So because you got one shot like this, and then one shot like this, right? So you see it from the front and you see it from the side. So that's what we mean by a lateral.
I'm confused.
Right? So, right? So AP, right? So you do this like AP of the arm, and then you look at this. This is lateral of the arm, right? Just like AP chest, lateral chest, AP arm, lateral arm.
But my arm is not lateral right now.
Your entire body is lateral, so your arm is also lateral to the central ray.
Oh, that's confusing.
Because it's looking at you from this way, so the whole thing is lateral.
Okay. So the projection is lateral. Okay.
That's right.
Okay.
So, a couple things that we need to keep in mind here. Number one, yes, you are going to see chest anatomy on top of the arm now, right? Because there's going to be ribs, there's going to be lungs, there's going to be heart in the way of the arm. So we're going to talk about ways to kind of remove those from the image. Second thing is that since the arm is now against the IR, it's very hard to center to this arm, isn't it?
Yeah.
Right? If I turn on the light, the laser's not really on this arm, right? The laser's kind of like over here on her right side. So what are we going to do? We're actually going to use this right side to kind of help us position. So for this one, because most fractures are at which part of the humerus?
The surgical neck.
That's right, the surgical neck. We're going to center on
Surgical neck.
the surgical neck. So we're going to raise our centering up here to around the surgical neck, right? So here's humeral head, right? Surgical neck's gonna be right underneath the humeral head. All right, careful, I'm gonna raise this up. Good. All right, gonna make sure our patient's in a nice lateral. Okay, gonna slide them forwards. And so, if I'm centered on this arm here, and my patient is in a true lateral, that means that I should also be centered on the opposite arm. Does that make sense?
Yes.
Right. So, leave both arms just hanging straight down, have a nice perfect lateral, center right here on this one, and this side should also be centered. Right. You can also kind of visually check. Right. So I've got this line here, I can see that, yep. This line goes straight to the center of this humerus, to the humeral head. Okay. And then honestly, before I did any of this, I really should have just taken the shield and turned it lateral as well. So, can you do that? All right, thank you, Regan. Okay, so now that we are here, right, so we've got our centering, and I'm gonna go ahead and collimate as well. Right? So I'm gonna collimate into the arm. I'm gonna cut off, I don't need all of that neck, right? So I'm just gonna be focusing right here on the humerus.